Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about 8 different types of chronic headaches and their signs. Many people suffer from severe headaches on a regular basis and choose to ignore them. Due to the fact that the symptoms can vary at times, you might not be aware of the exact reason of these headaches. Evidently, there are numerous varieties of headaches, each with a unique set of symptoms and reasons. Long-lasting or chronic headaches can be categorized into 2 groups based on their underlying causes: primary chronic headaches, also known as pure headaches without any underlying disorders, and chronic non-primary headaches, also known as chronic headaches caused by other diseases. Primary chronic headaches frequently go undiagnosed. Infection, inflammation, or problems of the brain's blood arteries, brain tumors, damage, and pressure issues in the brain are a few of the reasons of non-primary persistent headaches. Several types of protracted headaches that are frequently reported include: 1. Chronic headaches of tension. Both sides of the head feel pressure at the beginning of this sort of headache. There are moderate to medium levels of intensity. Chronic tension headaches can develop without a physical activity trigger. 2. Chronic migraine. People who have already experienced migraines are more likely to develop this form of migraine. Regular exercise might also contribute to chronic migraines. Headaches on one or both sides of the head, a throbbing sensation, and moderate to excruciating pain are all signs of chronic migraine. 3. Suddenly developing and persistent headaches. This kind of headache frequently strikes without warning. A throbbing headache or a stiffness in the head are symptoms. These headaches often range from mild to moderate in intensity and are not brought on by any specific activity. Usually happens 3 days in a row during the initial attack. 4. Hemicrania continua. A headache on one side of the head that repeatedly occurs with rising and declining intensity is the primary symptom of hemicrania continua. Frequently, the affected area's eyes are red and runny. The eyelids will appear drooping, the nose will be blocked and runny, and the pupils will typically enlarge. 5. Recurring headaches. Overusing painkillers is a common cause of recurrent headaches. Rebound headaches could happen if you take painkillers for an extended period of time. 6. Headache brought on by elevated intracranial pressure inside the head cavity. A brain tumor, cyst, or an increase in brain fluid volume can cause this form of headache, which raises the pressure inside the skull. Headaches that come on suddenly, are severe, and are accompanied by signs of other nerve diseases like vomiting, convulsions, and vision problems are among the symptoms. 7. Post-traumatic syndrome. Headaches that last a long time following a head injury. 8. Age-related headaches. People over the age of 60 who have elevated eye pressure or glaucoma, after recovering from a herpes infection, blood vessel illnesses such as giant cell arteritis, or for psychological reasons are more likely to experience this. How to deal with a recurring headache. A comprehensive examination is required to treat persistent headaches. This seeks to identify the headache's underlying cause, whether it be an infection, a neurological breakdown, or a history of intense headaches. A CT or MRI scan will be used during the evaluation by the doctor. To identify the cause and develop a diagnosis, the doctor may also consult with a specialist, such as a neurologist or psychiatrist, if necessary. There may be ongoing headaches in some situations, which call for long-term care. It's also important to realize that those who experience persistent headaches run the risk of developing other illnesses. Examples include anxiety, insomnia, depression, and other psychiatric and medical conditions. A persistent headache should not be taken lightly, especially if you have previously taken headache medication. If your headache does not go away right away, see a doctor right away. Your physician will identify the kind of chronic headache you are having and start treatment right away. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.